Today we're going to talk about knee range of motion and knee strength testing. So we're going to go through a variety of different tests today. So I'd like you to lie on your back, if you could. So for our first one here, we're going to look at knee range of motion. Of course, we're going to have, just for demonstration purposes, I'm going to have him do just active range of motion. He's going to slide his heel towards his butt, if you could. He's going to go as far as he can. Now when I'm palpating here, I'm going to go to the lateral epicondyle for my fulcrum, greater trochanter of the femur, and then lateral malleolus of the fibula. I'm going to take my measurement there, and we're at about 134 degrees of flexion, okay? For extension, I'm going to have him extend his knee, and he's going to push down into the table. Now, same bony landmarks there. And he's got about 4, maybe 5 degrees of hyperextension, but we can see I probably should elevate him with a towel or my fist or something else where he could use his other foot. Go ahead and push down again for me. He's got probably about 9 degrees of hyperextension there. So sometimes you have to prop him up, and I'd recommend like a small towel roll or something like that. Now for flexibility purposes, in this position we can take hamstring flexibility. There's a couple different ways that you can do hamstring flexibility. I'm going to grab the back, he's going to grab the back part of his knee, the back part of his leg, his thigh rather. He's going to go ahead and straighten his knee towards the ceiling. We call this the poplite heel angle, 90 degrees, or the active knee extension, so in 90. So some different ways you can label it. Same bony landmarks, okay? And we're going to look there, and you can get about 10, maybe 12 degrees of active knee extension. That's going to test flexibility for his hamstrings. We're trying to get as close to 0 as we can. Now, if you have some high-level dancers, or like someone who's really flexible, and you get them up there and like, no, that's pretty easy, it's a 0. You may have to do more of a passive straight leg raise test, where then you bring him up passively, and we go as far as we can go, and maybe some dancers can get back a little further, or gymnasts, okay? But you go ahead and hold there for me. But it would be passive, his knee would be straight, and then I can measure the angle down here. Just slide underneath your hand there, thanks. So we go to the greater trochanter, midline of the body, and then lateral epicondyle there. And that's how you measure that for hamstring length, okay? Now another one for hamstring, so we want to think about more proximally. So higher up, he can maximally flex his hip, and then he extends his knee. So you could label it as max hip flexion, knee extension, and I would take the same angle right there, okay? That's just a different way to measure hamstring flexibility. Now, for our other ones here, let's see here.
Knee bend.
What's that?
We do knee bend.
Yeah, we're going to go on your stomach,
Yeah.
to the front. So for measuring quad flexibility, I could get a small towel roll, and I usually like to prop them up a little bit, and then I'm going to passively take knee flexion there, okay? And same landmarks, greater trochanter, lateral malleolus of the fibula, and our lateral epicondyle. We can see here he's at about 125 degrees. Obviously he's a little tight. You probably want him around 130 degrees or more, like we talked about in class for normative values. Now the other thing is for measuring gastrocnemius flexibility, you can measure it in this position as well. Remember, it crosses the knee joint, so I want his knee extended. And I want to do dorsiflexion. And this goes into kind of our lab for next week, but whenever you're measuring this, it's going to be passive, so I'm going to push him. We're measuring flexibility for this one. So I'm going to be just below the lateral malleolus, the head of the fibula there. And this is going to be parallel with the 5th metatarsal. And all I'm going to do is, to help with this, I put my hand around the goniometer and the foot, and I passively dorsiflex. And he's lacking about 8 degrees away from 0, or neutral. And using the numbers on the top, the red numbers on this goniometer, the numbers that are on the top, because we're at that 90-degree point, okay? So those are your ones for flexibility. think we got them all there. We'll go into manual muscle testing next.
Never manual muscle test without shoes on. Hey, Yanni. Okay, so first we'll do knee extension. All right, so keep your patient sitting on the the clinch table or whatnot, and then I'm going to have him extend his knee. So go ahead and pick your knee up, your foot up into my hand. Great, and then go ahead and relax. So we know he has at least a 3 out of 5, right? Full range of motion against gravity. Perfect. So again, I'm going to have him kick up. Good, and then I'm going to have him back off a little bit so we get that muscle at its maximum or at mid-range, okay? I'm going to have you hold there. Don't let me push down, hard as you can. Oh, sorry about that. So again, let it bend, right there. I'm going to support him right here, okay? Give him, and then hold, hold, hold. Good. All right, 5 out of 5.
Bad patient.
Bad patient? It's a normal patient.
That's normal. That's not bad. That's my fault for not stabilizing, right? Okay, good. That's knee extension. That's the only one we do in this position, right?
Yeah, there's some people like to do like, with rotation or like vastus medialis or lateralis, but the literature doesn't support that. So, because they all have this common point of attachment by the patellar tendon into the tibial tuberosity. So, we're not going to probably teach that for that reason. So, you may see it in the clinic.
Yeah. Okay, so go ahead and lay down on your stomach for me, please. Yeah, the biggest thing as assistants is you need to know how the evaluating therapist performs their tests. And so you need to be familiar with that so that you can be consistent with the reproduction of those tests so that the results are valuable. Okay, so next we're going to test knee flexion strength, or those hamstrings. So go ahead and bring your heel up towards your butt for me. Awesome, thank you. So he's got at least 3 out of 5. So we're going to have you bring it up again. I'm going to have you bring it to about right there. So he's at mid-range there. Okay. I'm going to have the foot in a neutral position. And then I'm going to grab, you can support approximately. A lot of times I don't feel like you need to do a lot of supporting, but I'll just give a little bit of support here on the pelvis. Hold there, don't let me pull down. Fight, 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 fight. Great. Okay, relax. So that will be for the hamstring muscles for knee flexion. There are ways to kind of sensitize to either the medial or the lateral hamstrings. So our lateral hamstrings are which muscle group? Do you remember?
Is it the hamstring?
Yeah, the hamstrings are our lateral hamstring muscle group. Is the biceps femoris. Okay, and then our medial group are the semitendinosus and the semimembranosus. Okay, and if you remember, they can cause a rotatory type of movement at the tibia. Okay, so what we're going to do, if we're going to test the lateral hamstring muscles or sensitize the test towards them, we're going to externally rotate the tibia. So the toes are going to be facing the direction, or the hamstring group really. So if he's toeing out, it's going to be the outward or the lateral hamstring group. Okay, so I'm going to have him hold there. Don't let me move you. Fight, 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 fight. Okay. And then if I want to sensitize to the semitendinosus and membranosus, I'm going to have him internally or medially rotate the tibia. And then I'm going to have you hold there. Don't let me move you. Fight, 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 fight. Okay? Go ahead and relax.
I'm sorry, you said the toeing in was the semimembranosus?
Yeah, so toeing in or medial rotation of the tibia will be your medial hamstring group. Okay, tendinosus and membranosus. And then remember last week when we did the hip, so the hamstrings act as at the hip as well. So we do straight hip extension, that's glute and hammies, and we muscle test. And then remember we took the hammies out of it by flexing the knee, and that was focused more on glute max. Okay, relax. Okay, that's pretty much it. Pretty simple this week. So, okay, is that it, Dr. Monty?
Mm-hmm.
Okay, awesome. Thank you.